immune system. So we'll start with HIV or AIDS. So HIV or AIDS is transmitted usually from an HIV-infected pregnant woman to her fetus. This is known as vertical transmission or perinatal transmission. It is very, very important to know that the most common opportunistic infection in children with HIV is that of pneumocystitis jirovecii pneumonia. So this will most frequently occur between the ages of 3 to 6 months old. Other opportunistic infections include thrush, herpes simplex disease, or pulmonary a yeast infection of the pulmonary system as well. The assessment for a patient, a pediatric patient with HIV or AIDS, they're going to have a chronic cough, chronic diarrhea, night sweats. They're going to have weight loss, failure to thrive. So, very important to know your immunization, specifically in a patient with HIV or AIDS. So, immunizations against childhood diseases are recommended for all children, even those exposed to and infected with HIV. However, if the child has symptomatic HIV or if they're severely immunocompromised, they should not be given the measles vaccine, the rotavirus vaccine, or the varicella-zoster virus vaccine. They should not receive those vaccines. And then they should only receive the inactivated flu vaccine that is given IM and the inactivated polio vaccine that is given IM. So definitely know that if a patient has symptomatic HIV or if they're severely immunocompromised, they should not receive the measles vaccine, rotavirus vaccine, or the varicella-zoster virus vaccine, and they should only receive the inactivated flu vaccine and the inactivated polio vaccine that are both given IM. Now, if a patient has been exposed to or infected with HIV, but they are not symptomatic, they're not severely immunocompromised, then you need to recommend their regular childhood immunizations. All right, so diagnostics, they're performed in less than 18 months of age. It's used, the polymerase chain reaction or P24 antigen is used. Most children with HIV will develop symptoms within the first 9 months, and then the remaining children will become symptomatic sometime before 3 years of age. So interventions in dealing with children or infants that may be infected with HIV, you want to wear gloves when you're coming in contact with their body fluids. You want to clean up their body fluid spills with a 10-to-1 ratio of bleach and water, and then you want to discard any unused refrigerated food or formula after 24 hours. All right, rubeola or measles. This child is going to present with fever, the 3 C's, coryza, which is just inflammation of the mucous membranes of the nose, cough, conjunctivitis. They might have a rash and then Koplik spots as well. So Koplik spots are located on the inside of the cheeks, the buccal mucosa. They're small red spots with a bluish white center. This measles is very contagious. So it's contagious from 4 days before to 5 days after a rash appears. It's transmitted via airborne particles or direct contact with infectious droplets. So this patient will be placed on airborne, droplet, and contact precautions. All right, rubella or German measles. It is, the source of transmission is through nasopharyngeal secretions. It's also present in the blood, stool, and urine. Assessment consists of a rash that begins on the face and spreads to the entire body within 1 to 3 days. Petechiae may occur on the soft palate. This patient is also placed on airborne, droplet, and contact precautions. I'm going to go back 1 minute here. With rubeola or measles, the rash will also start on the face and spread downward. It's going to blanch easily with pressure, and it gradually turns a brownish color, and it may have desquamation as well. So then we have our German measles. Mumps. So mumps is contagious from immediately before and after parotid gland swelling begins. So it's transmitted via direct contact or droplet spread from an infected person. This patient is also placed on airborne contact and droplet precautions. They're going to have jaw or ear pain that's aggravated by chewing, followed by parotid gland swelling, and they may also have inflammation of the testes or ovaries. Okay, chickenpox or varicella is transmitted via direct contact, airborne, droplet spread, and with contaminated objects. So this patient is going to have a slight fever. They may have a poor appetite, followed by a macular rash that first appears on the trunk and scalp and then moves to the face and extremities. So you want to isolate the patient until the vesicles have dried or crust have formed. So they're contagious until the vesicles have crust over. Okay, pertussis or whooping cough. So it's transmitted via direct contact or droplet spread. The patient with pertussis, they're going to have symptoms of a respiratory infection, followed by an increased severity of cough with a very loud whooping inspiration. They may also experience cyanosis, respiratory distress, or tongue protrusion. So infants do not receive maternal immunity to pertussis, so they should receive the Tdap vaccine, or the Tdap vaccine should be given to women in the postpartum period and all of those in close contact with the infant to prevent spread. Okay, diphthera, definitely be able to recognize the characteristics specific to diphthera. So this patient is going to present with neck edema, or what's known as a bull neck. They will also have some foul-smelling mucopurulent nasal discharge, and then a possible pseudomembrane formation in the throat that may interfere with eating, drinking, and breathing. All right, poliomyelitis. Poliomyelitis is transmitted via direct contact with the infected person or fecal oral and oral pharyngeal routes. This patient will present with fever, sore throat, and they may have abdominal pain followed by soreness and stiffness of the trunk, neck, and limbs, and it could even progress to CNS paralysis. This patient is placed on enteric and contact precautions. No airborne precautions. Airborne precautions are not needed. Scarlet fever, another one that it's very important to recognize your assessment findings. So it's transmitted via direct contact or by droplet spread. Patients with scarlet fever are placed on airborne precautions for until 24 hours after starting antibiotics. So they're going to present with flushed cheeks. They're going to have a strawberry tongue, a fine sandpaper rash. They're going to have Pastia's sign, which is a pink or red line of petechiae that's noted in the areas of deep creases or folds of the joints. They're going to have sheet-like sloughing of the skin, and then again, they're going to have that red strawberry tongue. So the rash is going to develop in the armpits, the groin, and the neck, and then it spreads to cover the entire body except for the face. And again, this patient is placed on airborne precautions until 24 hours after starting antibiotics. Okay, erythema infectiosum or Fifth's disease. The transmission is unknown, but it's possibly transmitted through respiratory secretions or blood. So there's different stages. The first is going to be erythema of the face. They're going to present with the slapped cheek appearance. This is going to disappear within those first 4 days. And then maculopapular red spots are going to show up that are symmetrically distributed on the extremities. They're going to progress from proximal to distal. So before the development of the rash, usually the child is asymptomatic. And then it's very important for pregnant women to avoid any children with Fifth's disease. Infectious mono, it's transmitted via direct intimate contact. The source is oral secretions. This patient is going to have a fever, sore throat. They're going to have enlarged, very tender tonsils. They're going to have lymphadenopathy and then hepatosplenomegaly as well. For this patient, you want to monitor for splenic rupture. Signs of splenic rupture are going to include abdominal pain, left upper quadrant pain, or left shoulder pain. Rocky Mountain spotted fever, it's caused by the bite of an infected tick. The patient will present with fever, myalgias, a rash that's primarily on the extremities, but it may spread to other areas as well.